Good morning, everyone, and welcome to the NHS Providers Conference 2023. I'm Samira Ahmed. I'm delighted to be back. Some of you were here last year as your host. As a journalist, we always like a bit of a news story for an event like we're doing, and we've got, I think, at least three, starting with the ongoing COVID inquiry and all the evidence that's emerging there. We also have a new Secretary of State, which is interesting. And, of course, the news you may have woken up to this morning that NHS providers have requested £1 billion to cope with the cost of strikes, and it looks like they're going to get, according to my maths, 10% of that. So very interesting, the climate in which we go into this conference and all the issues that there are. I will also take this opportunity to express my personal thanks for all the incredible work that you and your colleagues do as we're going into another hard winter as well. So welcome, everyone. And a special welcome to those of you who are attending for the first time. Appreciate you taking the time out from your work to come and be here. Over the next 2 years, we'll be discussing and debating the key challenges and opportunities that you're facing. This year's theme, as you may have noticed, is vital, representing the essential care the provider sector delivers, the deep commitment of staff, and the importance of ensuring our health service is sustainable for the future. We have some terrific discussions lined up for you and lots of excellent speakers, an opportunity as well for you to ask questions. Today's conference will begin with opening remarks from Sir Julian Hartley, who is the Chief Executive of NHS Providers. He'll be reflecting on the achievements in the sector, despite the challenges being faced. And later today, we're also going to hear from Margaret Hefferman, another keynote speaker, who will be focusing on key leadership challenges that NHS provider organisations are facing. We'll also have 2 panel discussions today that will focus on achieving sustainable recovery on the backlog and embedding a culture of improvement and innovation. I'd also like to encourage all of you to take the time to visit the exhibition stands during the breaks, and we'll also be running the Delivering with Partner sessions from the theatre spaces in the hall. And can I draw your attention as well to the Providers Deliver area, also in the exhibition hall, where 10 trusts are sharing their pioneering initiatives. So before I invite Sir Julian to the stage, I have a few practical things to run over with you and some thank yous on behalf of NHS providers. First, again, thank you for taking the time to attend the conference. It wouldn't be a success without so many of you attending in the numbers that you do. I'd like to offer our continued thanks to the many exhibitors, sponsors and supporters of this year's event. We very much appreciate your support, without which we wouldn't be able to put on face-to-face events of the likes of our annual conference. And we hope to see you all again next year. I think there's a slide with some info. Throughout the conference, we're encouraging you to share your thoughts and views on X, formerly Twitter, and on LinkedIn. And when you post, please use hashtag NHSP23 and tagging us at NHS Providers. Just so you know, there's a photographer on site and all plenary sessions will be recorded. Photographs and footage may be used on our website and social media channels. No fire alarm tests are expected today, so if you hear the fire alarm then a verbal announcement, which will be made via the PA system, please follow instructions from the stewards and make your way to the nearest fire exits. Can I ask you to take a moment to check your mobile phones are on silent during the sessions? And finally, to make them as interactive as possible, apart from our opening speech, we'll be taking questions from the audience throughout. We have roving mics, so you'll be able to raise your hands if you'd like to ask a question, and we'll get a member of staff over to you with the mics. But you can also submit your questions using your phone or tablet via the Shake It platform. There's a QR code to scan. You select the session, or you can follow the website address on the screen and go to Ask a Question. Find the session you want, type your question, and if you could, we'd love to know your name or your job title and your organisation so we can identify you when you get a sense of why you're asking the question you have. And we're live streaming the plenary sessions. So those of you who are joining us remotely, you can also participate in the Q&A by using the Ask a Question function. So that's just to get things going. I'm delighted now to welcome our first speaker to the stage, the NHS Providers Chief Executive, Sir Julian Hartley.
Well, good morning, everyone. It's fantastic to see you all here. In terms of the timing of our conference, we've managed to avoid doctor strikes, we managed to avoid rail strikes, but we didn't manage to avoid a major cabinet reshuffle and a new Secretary of State. Nevertheless, We are here, and it is great to bring you all together for what is the biggest gathering of NHS provider board members in the NHS calendar. Now, we couldn't have done this without the generous support of our sponsors, so many, many thanks to all of our sponsors, in particular our headline sponsors, Altera Digital Health, BD, Hempsons and Newton. Many thanks to you all for supporting us generously, and great to have Samira with us as well. So, the theme of our conference is vital. And I first of all want to say how vital it feels right now, the role that all of you play as leaders in your organisations, supporting your staff, addressing what are genuinely eye-watering challenges, and the intensity of the challenge right now we cannot underestimate. But it is vital that all of you are also dealers in hope. So we come together to reflect on what is working really well, the key achievements, and how many of you are really facing into it and addressing some of those big, big challenges. And I guess for all of us, it takes us back to the core principles and values of the National Health Service. You know, the importance of that service being free at the point of need, comprehensively available to all, irrespective of ability to pay, and that compassionate, inclusive approach that I know all of you take. I mean, it does take me back to growing up in West Yorkshire and, you know, having an early awakening about the importance of healthcare and education being provided by the state at high quality. And I think about the way my life has been transformed by both the NHS and education. I'm sure the same is the case for many of you. And then joining the NHS as a general management trainee back in 1991, I can still remember that kind of 3 months of cook store, doing every job there was to do in Sunderland District General Hospital, porter, cleaner, following around the doctors, consultants, nurses, engineers, accountants. And I still think about how it takes all of those different roles to bring together that sense of shared purpose for delivery of great services to patients. And so, of course, moving through my career, working in the North East and the North West and Yorkshire, learning about the critical value of deep employee engagement, continuous quality improvement, which really does drive the better care and treatment and experience of patients. I think those things feel more important now than they ever have. And all of you I know are working in those ways to really make that happen. And at the heart of all of this is that recognition that a more equal, inclusive, diverse NHS, the evidence tells us, is better for staff and patients, and our hearts tell us that's where we need to be. So in some ways, it's a shame we haven't got the former Secretary of State here to tell him that, but nevertheless, the new Secretary of State, I'm sure, will be wanting to convey the importance of that. So our role as your membership organisation, standing up for the NHS and for you at a key time, constantly reinforcing those key messages, but also shining a light on what really is making a difference. And so what I want to do next is just take you through our State of the Provider Sector survey, which all of you have contributed to. You may have heard me on the media round this morning talking about some of those key challenges, but I want to reflect back to you not only the reality of the challenges that we're facing into, but also the achievements that many of you are making in the face of those big challenges. So as usual, we issued our State of the Provider Sector report, and it's given us a really good read on where we stand right now. So we see the scale of the pressures, and the comprehensive picture tells us 80% of you think that the coming winter, I mean, it feels like we're in it right now, doesn't it, will be worse than previously. The worst, actually, than last year, which was the worst on record. 84% of you are concerned about the current level of staff burnout and morale. And I think this is a key factor, isn't it? You know, the importance of discretionary effort from our teams, the vital importance of making sure we've got that sense of shared purpose among staff, and the danger of the fracturing and fissures that industrial action is opening up. And 89% of you are deeply worried that not enough investment is being made in social care. And this really does come through in the experience that you talk about and that we describe. You know, the pressure on social care services and the impact on the NHS in every sector has been profound. And some of your comments, and just to quote one or two comments that come through, because I think they kind of capture the challenges. This from a chief exec of a combined mental health and learning disability trust. No additional financial allocation for mental health and learning disabilities and autism to bolster resources during the winter. Throughout the year, we've already seen significant pressure on beds, including people not previously known to mental health services because of post-pandemic and cost of living impact. And there's no doubt that there has been a profound shift, I think, since pre-pandemic in terms of what the NHS is dealing with as the reverberations of the pandemic play through, particularly in mental health and in children and young people, and obviously in acute services, community services, and indeed ambulance. So I think we're all aware that we're dealing with a clearly unprecedented challenge. But there are there's some positive signs we should talk about in response to what you've said about planning for the upcoming winter. And many of you have talked about how you're working more effectively in systems. And this from a chief exec in a specialist trust in the east of England. Building on the success of last year's system seasonal plan, we're working up a comprehensive integrated winter plan, which includes mutual aid, all providers engaging with staff to maintain positive employee relations locally, and investing in staff support initiatives to help with the cost of living. So there's clear agency and actions that are being taken at a system level and indeed a trust level to really try to mitigate some of the challenges that we're likely to face. So the results of the survey really crystallise around three major areas, those being workforce, finance, and patient safety and quality. And if we deal with those in turn, first of all, workforce, where we've seen the corrosive impact of strike action. I mean, I can remember, I was still in Leeds in December when we had the first nurses' strike. I mean, it's nearly a year of that cycle of industrial action that you have been dealing with. And all the time we get the reports about it's not just the kind of impact on, obviously, on patients first and foremost and on finances, but it's that leadership bandwidth and it's your teams that are being absolutely stretched to the limit in terms of dealing with the cycles of industrial action that continue. And we are, of course, keeping everything crossed that we see a resolution to this. And just this morning, I was saying to some of the interviews I was doing about the importance of our new Secretary of State prioritising resolving strike action as a key priority, because the consequences of strike action on top of the winter challenges we're facing would be intolerable. Indeed, Chief Exec in the east of England talked about strike action on top of winter will cripple the NHS. So we do need to see that resolved. We do need to do everything possible to bring that to an end, to give us a chance of managing through a difficult winter. But also on the workforce challenges, your responses also reveal how you're preparing your trust and staff for the challenges beyond the short term. And you report how you're planning for and implementing both the NHS long-term workforce plan and the Equality, Diversity and Inclusion Improvement Plan. And some of you may remember we ran roundtables and events where Navina came to talk through that and helped shape and support her in that. And a number of you I know have been involved in that work. And many of you in the survey gave examples of how you've changed your medium-term workforce planning due to the long-term workforce plan, including exploring dual and widening roles, multidisciplinary education and training, scaling up apprenticeships, and particularly apprenticeships for people with learning disabilities and autism, which I think is fantastic. We're seeing more of that happening. And working more closely with university and local authority partners. And certainly, I think one of the things I found most sort of productive and gratifying was bringing together 57,000 people that worked in health and care in Leeds into the Health and Care Academy. People not only working together, but learning together. So there is some hope, I think, in terms of the medium term around involvement in that. And on the EDI improvement plan, a comment from a chief exec of a mental health and learning disabilities trust, a very helpful publication has enabled better detail and triangulation, clearer asks, and much improved data and requirements. So I think on workforce, obviously the here and now is incredibly challenging. We are seeing some good work and reduction in, the agency costs, but the experience of staff, I think, over the course of the year and the extent of the challenge we can't underestimate. So, big challenge number 2, finance. And I'm sure all of you will be aware of just how difficult and feeling this right here, right now. So, the already stretching savings targets have been compounded, obviously by strike costs, a total of 1.4 billion in direct and indirect costs of strike action. And of course, you know the allocation of 800 million that will be played out through systems, but the bulk of that is, of course, being borne largely by NHS England and the Department of Health and Social Care, and this will have direct consequences for investments in capital, technology, as well as a slowdown in the pace of elective recovery, which seems such a pity when, despite strike action, trusts have made remarkable progress in relation to elective recovery. And I think a number of you reflect on the scale of that financial challenge in your comments. We're currently forecasting a deficit for the first time in the trust's history from a community trust chief exec. Savings targets completely unrealistic, no joined-up thinking between pressures to meet 65-week wait targets and the ask to cut costs so significantly from an acute trust in the southeast. So I think we've got to be realistic, haven't we? We talk about the importance of the achievements, but we do have to speak truth to power. We do have to be clear about the scale of the challenge that the NHS is being asked to deliver on winter elective recovery and balancing the books. And certainly that was my message this morning. There's also quite a focus on this question of productivity. And I'm sure many of you have been asking yourselves the question about the issue that is at play at the moment about productivity being in the spotlight in relation to what we're doing. And I think a few important things to say about this. We mustn't forget that the impact on people's physical, mental, and social health following the pandemic has been profound. I mean, we are seeing a scale of demand for mental health services, children and young people services, the complexity and acuity of patients that are presenting, the challenges with social care and the number of patients still in hospital settings that would be better served in community settings. Those are all playing into, I think, an incredibly challenging piece. And I think that we need to be careful not to let an overly simplistic comparison of where we are now against where we were in 2019 shape a narrative that the NHS is somehow inefficient or unproductive, when actually, when we look into the detail of this, as we have done in some cases, we see that the reverse is often the case. And despite all of those pressures, the NHS is still delivering really strongly in terms of its ability to deliver elective recovery, manage winter, and manage the increasing challenge of demand. So, of course, there's a connection here, isn't there, between the money and, of course, the investment in capital. And capital investment in both estate and digital. In our report, which hopefully you will have seen, No More Sticking Plasters, we highlighted the challenges and the major shortcomings of capital investment across the NHS, and this year's survey reinforces that. 70% of you are clear that you will not have sufficient capital over the next 3 years to address high and significant risk maintenance backlog. And a couple of comments really underline this. There's very limited capital available at a system or national level. Even when capital is made available nationally, it comes at short notice with a very prescribed set of criteria from a CEO in an acute trust and from a mental health trust CEO. There are still mental health services working out of 1830s buildings. Now, I can testify to that. I mean, I've seen the impact. It's extraordinary, actually, when I go round and do a lot of visits. Just particularly in mental health settings, the challenge and the importance of the environment in mental health. You know, it is part and parcel of the therapeutic environment for patients. And I've seen some of the best and some of the worst. And just in terms of the underrepresentation of mental health in the new hospitals programme and in capital investment, that is something we are clear that we need to speak up about and push on your behalf. So capital investment is clearly a big, big issue for us. The third big issue, of course, which probably the most critical right now, is patient safety and quality of care. And our survey reveals concerns about the quality of care trusts are able to deliver given the workforce and financial challenges. Only 40% of you rated the current quality of healthcare you deliver as high. That's about a 10% drop on last year. And the reverberations of the conviction of Let Be, the response to Martha's Rule, the spotlight on maternity, and high-profile inquiries into mental health have all focused attention on the role of boards and trust leaders in creating and sustaining a culture of quality and openness. And I guess this represents one of the big, big challenges right here, right now, given the other workforce and financial challenges that we are facing. And a comment from an acute and community trust chief exec: too sharp a focus on the finance will lead to drops in quality, patient experience and outcomes and care standards, thereby impacting both patient and staff experience. The risk of increasing harm and moral injury to staff if provision of care isn't at the standard required due to financial restraint. So, the scale of the challenge for trusts and leaders is extraordinary, and our survey reveals that. The most intense, heightened, gut-wrenchingly difficult period probably that many of you have ever faced. But this isn't a counsel of despair, because there are so many good things that are happening across the service where all of you are facing into those challenges and connecting and working really, really closely with frontline teams and your systems to tackle and manage those big challenges. And what I want to do, actually, is share with you just how some of our trusts are rising to those challenges. Now, hopefully, you will see every Monday morning when we send out Start the Week examples of what many organisations are doing. And I'd commend those to you because I draw great inspiration from those visits. And I know Saffron, Miriam and other members of providers, we go out, we visit, we learn about what you're doing. But our job is also to reflect back, to share good practice and create an opportunity for us as a sector to be learning from one another. So I want to just give you a few examples of some of the things that we've seen and some of the things I think are really supporting work to face into and address some of those challenges. So on improvement, at East Lancashire hospitals, the work on quality improvement as part of the Vital Signs programme has created a really strong connectivity between executives and frontline teams, with the conviction that only those people doing the work can improve the work. The improvement method's been applied to the challenges of patient flow by focusing on ambulance handover. Community colleagues are supporting prompt and effective triage, and the award-winning virtual ward scheme eases pressure on the hospital and provides safe care. On staff engagement and workforce redesign, at London Ambulance Service, a focus on core values of caring, respect and teamwork has underpinned, genuinely, I think, groundbreaking work on empowering frontline staff to organise their own rotas, to ensure flexibility and promote well-being and work-life balance. One frontline colleague, there we are in the control room at London Ambulance, told me that in more than 30 years, the service had never seen such a commitment to staff well-being. Unsurprisingly, sickness rates have fallen dramatically, and staff satisfaction and engagement are rising significantly, which is no mean feat in the current climate and the challenges for ambulance services. On integration, the work of Tameside and Glossop Integrated Care NHS Foundation Trust brings together acute, community and social care to serve some of the most deprived communities in the northwest of England. In Tameside, integration is a reality, with the digital health team bringing together district nurses, ED nurses, midwives, paramedics and the community crisis team to handle over 16,000 contacts a month, which have shortened length of stay, avoided thousands of ED attendances and hospital admissions. And on provider collaboration and partnership, in the southwest, the Acute Hospitals Alliance is working on shared capital plans, demand and capacity modelling, including a unified waiting list across Bath, North East Somerset, Swindon and Wiltshire. And in addition, United Hospitals Bath have established United Care Baines, which is a joint venture with the council in which health and social care workers are employed by the NHS and work in home care settings, significantly reducing patients with no reason to reside. And then on the massively important issue of capital redevelopment in mental health, it was great to go to the Springfield Village development in southwest London and St George's Mental Health Trust, who've created a beautiful artistic environment for mental health inpatients, where the adjoining retail and residential development are integrated as part of the wider community support for mental health and well-being. And I was really struck by the way in which the local community had embraced that mission and really worked on the awareness and profile and positive response around mental health. So those are just a few examples, and of course there are many, many more of the innovative, imaginative, groundbreaking work that our trusts are engaged in to tackle the fundamental and deep-seated issues we face in health and care. And here at NHS Providers, we want to showcase those and share them and learn from one another. And there are many more examples of that in our Providers Deliver report, which many of you have contributed to, and the most recent one on staff health and well-being. Do check out the Providers Deliver stand in the exhibition hall to find out more. So, how can we, as your membership organisation, continue to help and support you by working with you? Well, I have to confess, I was struck coming into this job just by, obviously, I sat where you're sat for many years, seen the genesis of NHS Providers from the Foundation Trust network and really experienced the output. But pulling back the curtain and being behind the scenes, just struck by the great depth and detail and commitment and dedication of the team. The media is obviously the most visible, but I've also been struck by the quality and insight that goes into all those outputs that you get, the events and commentary, the reports, the briefings, the webinars. And do make sure you keep feeding back to us, as you do, about those resources and the quality of those. And I do acknowledge at the moment, you've got a lot in your inbox. So we try to be judicious, but we try to add value to you in terms of what we describe and support you with. And also our development and engagement programs on digital boards, board development, and recently the learning from the Virginia Mason program have met with really good feedback. And we've got a big focus as well on provider collaboration, which I think is actually, in the context of system working, really fundamental to where we need to go. And I've been impressed that we've got a values-based organisation at NHS Providers with those values of respectful, inclusive, collaborative and effective, hardwired into everything we do. A really good team, really talented team, and motivated by the mission to enable high-quality care for patients and service users and a reduction in health inequalities an actively anti-racist organisation, strengthened and enriched through its diversity, and crucially working as a team. Because just as you all work as a team, as chairs, as chief execs, as executive colleagues, and your wider team, so we work as a team, an executive team and a team of trustees, drawn exclusively from you, our members. And I just want to thank Ron, as chair, for his wise counsel and guidance, and particularly to thank Saffron for her generous and good-hearted support as we navigate together the rather shark-infested waters of government, politics and media to stand up for all of you. And this is how we do it.
Lovely. Rolling.
The values that really matter at NHS Providers are some values that we've developed.
Being collaborative,
inclusive,
respectful,
and also about being really effective.
and I can feel that every day.
I don't think I've ever worked with a team that is so committed to what they do.
we want to let our members know that we have their best interests in mind.
And we're committed to being the best that we can for the members that we represent.
We represent all NHS trusts across the English NHS, and that's in all sectors.
Acute hospitals, mental health trusts, community services and ambulance services.
What NHS Providers does is we champion and support our members and their work,
And we're here to be the voice of those organisations.
influencing on their behalf to really represent their concerns, issues and views at the highest levels of government, but also to bring members together to support one another in challenging times. There'll be a significant amount of interruptions.
Well, we know it's an incredibly pressured time across the NHS.
We seek to keep members really up to date with all developments across the health and care sector.
We set up interviews, we write press comments, we write op-eds for newspapers and for websites.
We need to ensure there is a positive narrative about what NHS trusts are doing to combat the major challenges that they are facing.
What we do know, and what trust leaders who are members of my organisation are focusing on, is how we minimise the impact on patients.
One of the best things about NHS Providers is that we're reliable, we're authoritative and we're credible.
Having worked in the clinical environment myself, I would say that the value that we bring is instrumental.
And a lot of it is focused around gathering the data on what's really going on in the front line.
We cover a wide range of topics across pensions, pay.
From cancer waiting lists to elective care to A&E and ambulance services, for example, from all hospitals across the country.
One of the key things for us that's really valuable for members is the on-the-day briefings that we do. Having kind of the top lines and key messages up front is really crucial.
The data that comes from surveys is really important. We are very reactive when something new comes along. For example, strike data. The moment these data started being published, we created an analysis program for it. Our members really valued having that information.
One of the core values of NHS Providers that's really important to me is inclusiveness.
And not being able to be yourself at work or be your whole self at work can be really detrimental.
I'm the chair of the Race Equality Cultural Inclusion Group.
I'm the chair of the Mental Health Network.
I am the chair of the LGBTQ+ network.
Half the battle is getting people willing to talk about mental health in the first place.
It's really important to have that space where people can come together and foster inclusiveness.
We believe that if we're an inclusive organisation, it sets precedents and standard for our members to see that inclusiveness is important. Inclusiveness does increase retention. Inclusiveness does also increase the well-being of staff.
Just that open culture of talking has been something that I'm really proud of hopefully helping to cultivate.
It's really important that we support our members in their development goals. Obviously, the pressure that there is on boards on quality, governance, finances, on operational performance,
on digital transformation. Now, in all of those areas, we're very active in helping support our members.
We hold both virtual and face-to-face network events, and these events are a safe place for trust leaders to influence, to learn, to share good practice.
We have 12 member networks. We recently had our Chairs and Chief Executives network. We also have HR directors, strategy directors, community health leads, mental health leads, so all of those kind of like board level, executive and non-executive director level roles.
We have over 98% of trust leaders saying they would definitely attend another network event, and these events are part of your core membership, so I wouldn't miss the opportunity to attend. It's very cliche, but the best thing about working for NHS providers is we're all striving to work towards the same goal.
The real focus for NHS providers is, at the end of the day, to make sure that we support our trust to deliver the best quality care that they can to patients and service users.
And we just want to make sure that that trust is really cemented in our organisation.
We see people going above and beyond all of the time, and I think there is a real pull, knowing what's going on for our member trusts on the front line, to be able to support them as much as they can.
My message to our members, all of whom are doing incredible work at tough times, is that we are here for you, and we are here to support the work you are doing to genuinely transform opportunities and roles for staff and really deliver the kind of care that we know we all want to deliver for our patients now and in the future.
So we're working for you. And the difference we're making on the priorities that matter, working in partnership, NHS providers and trusts are delivering solutions for patients, staff, communities, to try and safeguard and strengthen the future of the NHS. Now, of course, we can't ourselves, sadly, call off the strikes, but we've spoken truth to power and to the public, and you've helped us do that. We've offered a clear, evidence-based commentary explaining the severity of the situation, the impact of industrial action, and the urgent need for resolution. We've worked in coalition to make the case for the long-term workforce plan and the EDI improvement plan and helped shape the final publication. Obviously supported trusts to prepare for the COVID-19 public inquiry and help the inquiry understand our members' role in responding to the pandemic and its impact on them through our own submission to the inquiry. And of course, you know we've campaigned for capital investment, including addressing and raising the issue of RAC long before it became a political emergency. And we've highlighted the problems, of course, as well with the regulatory system. And we've engaged, I think, wholeheartedly with the CQC. And if you read today's HSJ, and thank you to the HSJ for being our media partner this week, but, you know, points made in feedback from colleagues about the CQC, referenced in our regulation report, and obviously working on your behalf with them to highlight that and to influence the new regime and the new model. And of course, we've engaged heavily with the Hewitt Review, looking at system working and making sure that trust perspectives on that were being recognised and heard. And also, Providers Deliver series on a whole range of topics, including staff and health and well-being, but also a focus on governance and how provider collaboratives can come together and work well, and the right governance structures that can support that. We're working with you, with the government and opposition parties and NHS England to respond swiftly on issues of manager regulation, the reverberations of Let Be, and all of those issues as well. So, it's clear that NHS trusts are absolutely at the centre of the various calls for improvement and reform of the NHS. I mean, trusts are where patients are treated, where services are delivered, and where the money is spent, and where staff are employed. So, how can we, together, shape the future that we need? Well, by focusing on quality of care, reducing waste, and engaging staff through continuous quality improvements, and using the new NHS Impact framework to help support progress towards that. by acting, as many of you already are, as anchor institutions in our own communities, creating employment, reducing inequalities, delivering population health benefits for those who need them most. By partnering with universities, life sciences, local authorities to drive research, innovation, and economic growth. By working as provider collaboratives to be greater than the sum of the parts, empowered by ICBs and released from the strictures of a top-down performance management approach to be able to come together as provider collaboratives to address the pressing concerns of fragile services, economies of scale and scope, managing waiting lists and elective recovery and urgent care. By leading the NHS response to race and health equality and targeting carbon net zero, responding to two of society's most pressing concerns. And by investing in leadership development, implementing the recommendations of the Messenger Review, increasing leadership diversity, supporting the work of groups like the CECOL group of ethnic minority non-executive directors and APNA, the Asian Professionals National Alliance, both of whom I've had the pleasure of working with. And together with the range of thriving staff networks in all of your organisations supporting race equality. We also support the Disabled NHS Directors Network, which strengthens the impact and voice of disabled leaders and staff. Leadership in the NHS, you don't need me to tell you this, but is a deeply serious privilege, but also should be a joyful and rewarding opportunity. And we need to encourage and support the future pipeline of NHS leaders who will take us to the 100th anniversary of the NHS. But we can't do all that alone. We need the government and central bodies to work with us to shift away from short-termism and focus on the long term so we can secure and strengthen the NHS for the future, planning across 3-year cycles to give trust and systems the stability and certainty needed, because we always overestimate what we can do in 1 year and underestimate what we can do in 3. And we need a cross-government approach to population health and prevention, including clear commitments to reduce health inequalities and to reform and fund social care adequately. And we have to set the NHS up for success by prioritising and supporting all of its people. Actions needed to prioritise and enable a thriving NHS workforce and the ongoing backing for the NHS long-term workforce plan, including support for roles like physician associates, which add real value to ward-based care and multidisciplinary team working. We do need much greater capital flexibilities, private-public partnerships to address the major deficits across NHS buildings and digital infrastructure, connecting with research, innovation, life sciences. And we must address the serious underinvestment in mental health capital. And of course, a framework to evaluate all of that. An evidence-based approach to demonstrate the progress and impact our policies and interventions make over time, just as we have done by assessing and the evidence base for the positive impact of equality, diversity and inclusion and continuous quality improvement. So finally, we need the backing, support and encouragement of current and future governments to the leaders of our NHS organisations, who I know are ready to respond to these future challenges, just as you are doing in the current ones. The answers to the future success and sustainability of the NHS lie in large part with us, with all of you. And there are already signs of the great achievements that all of you are making to really move the dial on the big challenges that we face. So right now, right here, it is vital that we support you and that you are inspired and enabled to go forward to make the difference for patients at probably one of the most important periods of the NHS's history. Thank you very much. Have a great conference.